It essentially allows both agencies and referral sources and users to interact with the directory. So as you're looking for a resource in the directory, if you find that a directory or a listing is outdated, you can actually in real time suggest the update and it will go into their database system, and there's a verification process for how that works, and then it will become updated.
Right.
The other part of it is that Aunt Bertha uses a proprietary technology to scour kind of the internet for publicly available sources of information. So .gov websites, GuideStar websites, federal websites, any place, even Facebook, where there's public information, they're scouring that to say, oh, Bloomington Meals on Wheels looks like they have a new phone number. It doesn't match what we have in our database. Let's reach out to them kind of automatically and ping them to see if we can update that. So the power of this solution is really in the fact that, number one, the information is widely accessible because it's available on the web and it's available to be searched and customized for what that individual seeker is looking for. And the second part is really what you touched on, is the ability for that directory to kind of constantly being updated, whether it's by the seeker or by the social service agency or the provider themselves. Always can be pumping information into it, so it's always going to be being refreshed and updated.
So you use the term seeker, and I know that in this database and with Aunt Bertha, they use the term seeker. Seekers are those who are seeking information.
Correct.
And helpers, those who have the resources that they want to have. And so I want to sort of talk about two different ones. So the helpers starting out is how do they get their information into the database, or if they're in there, how do they make sure that it's up to date?
Great, so great question. So right now, currently on helpingbloomingtonmonroe.org, there are over 1,700 programs that serve our community. And I would encourage folks who are following along live or who are pulling up their phone to go to helpingbloomingtonmonroe.org. And quite literally, all you have to do is type in your zip code. And there's even some resources, if you're not sure your zip code, we can kind of help make that easy. You can actually search by keyword as well. But if you type in your zip code, it will instantly bring up the resources that serve your zip code. Some of those are local resources, some of those are state resources, and even some of those are federal resources. So it really is a powerful tool in helping to give our community a line of sight into resources that maybe they didn't know they were eligible for, because it's a federal program perhaps. So if I'm a social service agency or a helper and I have a listing in helpingbloomingtonmonroe.org, it's very, very easy for me to kind of manage that listing. So the first step that you can take is you can, what they call is claim your listing. And so you quite literally click the claim your listing button, you type in your email address, and then the folks at Aunt Bertha will validate that URL and that domain matches the organization, and then you become connected to that listing. So if you're the executive director of Bloomington Meals on Wheels, for example, you can go in and claim that program. So that gives you direct access to maintain and manage the listings that are held within your listing card. So if you got a new grant and now you can be open on Saturdays, you could update your hours. Or if you lost some grant funding and now you're only open half day on Friday, you can update your listing. If you have new programs or a new website or a new phone number, the project or the agency owner, if you will, can constantly be interacting with their listing to keep it current.
Yeah. So once you claim your listing, then you're responsible for updating, or will Aunt Bertha, who is the back operator for or maintainer for Helping Bloomington Monroe, will they also update? Yeah.
So great question. So there's two funnels, if you will. So one is Aunt Bertha's constantly. Their claim is that they will update every resource in the directory at least every 6 months. So every directory gets reviewed every 6 months. And then, so that's a process that they're constantly ongoing at Aunt Bertha. But then simultaneously, another way is for that agency owner or that program owner to be able to proactively push information into that.
And then it'll go faster.
Yeah.
Don't have to wait till 6 months.
It's always the data that, the data in is, or the data out is only as good as the data in. So that's one of the big calls to action we have as we launch this, is for social service agencies and folks who have services that they want people to be able to navigate to. Go in and claim your listing.
So if you're following along with us on Facebook, go to helpingbloomingtonmonroe.org and you can see exactly what we're talking about. If you're a seeker, and that's a person who is looking for a resource and seeking information, then you can go in, you said you put your zip code in, and then there are labels for whether you're looking for food or housing or childcare or senior services, and then you just go in and click those labels and then they come up.
Absolutely. So it's a very simple, easy to use interface. It's actually very robust, but from a user experience, they designed it very intentionally to make it as linear and as easy to understand and as accessible as possible. And so you type in your zip code, you search by a keyword, and you can say you're looking for food, or maybe you're trying to help a seeker. So maybe your neighbor, your neighbor is struggling with food insecurity, or maybe you're at church and you serve on the welfare committee of your church, and you know that there's somebody in your congregation that's struggling with access to food. So you can go in and type in the zip code, pull open food, search for the different types of resources, whether it's food bank or food pantry or delivery services. So there's some subcategories, but in this instance, let's say we're looking for a food pantry, then I can go in and quickly I see Mother Hubbard's Cupboard is listed there, and I can quickly see their hours of operation, where they're located. There's a GPS function in there that can help me map to that resource if I'm using a smartphone. I can access the website there. I can call them directly. And so that is the way a seeker or someone who's helping a seeker find a resource. And importantly, we know that not everybody who may be in need is going to have access to the internet or have access to a smartphone. And so we've partnered with the Monroe County Public Library, and they have this resource. We did a training with them early this week, so they're available to be able to help navigate people to resources. And then importantly, if you're sitting navigating somebody at church and they may not have access to the internet, you can print off the directory and you can hand deliver a copy of that listing to someone. So as they leave that moment, or Dr. McKinley saying, when I'm in the moment with a patient and I'm trying to help them get connected to resources outside of my practice, I can print off resources and refer them to that directly. So it's a very, very simple, easy interface to help connect that seeker. And they can search, again, 1,700 different programs right now. But it doesn't feel overwhelming. It feels easy to navigate once you kind of know what service it is that you're looking for.
So if you're an agency and you go into Helping Bloomington Monroe and you don't see your agency there, how do you get listed?
Yeah, great question. So there's a couple of options. So within the Aunt Bertha helpingbloomingtonmonroe.org platform, there's a suggest a program link on the bottom right-hand corner. So if you're the executive director of a program, or your church, you know that your church offers some services that you want to be listed, there's a function right in the ecosystem of the website where you can simply check suggest a program. And then you fill out maybe 5 to 7 basic fields, phone number, contact, types of services, and then you could submit that to Aunt Bertha down in Texas, and they'll validate that information, and then they will then put that information up in the directory. The other option too, I say for folks, if you don't want to do that, you can just email me. So we are very interested in making sure that this is as robust as we can possibly make it. And so if that's not an easy solution for you and people want to have direct access to somebody on the Health Foundation team, you can just email us and we'll work directly.
Yeah, the thing I really like about this is that you can do it privately. So many people are looking for information and they don't want to walk into an agency or don't know what agency to walk into. And so you can do it privately. It maintains your dignity. You don't feel like you're giving out your information to 3 or 4 or 5 different places just to get where you need to be. But at the same time, I think people may have some concerns about privacy. because they're putting things online, like how much of their information is being maintained, what's going to be done with that information?
Yeah, so a couple is really good, in today's day we're hyper, and rightfully so, hypersensitive to kind of security and privacy issues. So from a seeker standpoint, there's no information that you're required to put in that's self-identifying to access this directory. It's completely free to use. There is no fee. There are no advertisements. The directory is completely free to use, and you don't need to put in any personally identifiable information to access the information. So to your point, if I'm trying to discreetly navigate to services for myself or a loved one, you can do that, in the comfort and privacy of your own home to be able to do that. For agencies who can facilitate, and this is a more kind of advanced feature, but for agencies can facilitate what's called closed loop referrals. So I can refer someone to another agency, and actually with the client's permission, I can put that in there. The Aunt Bertha platform meets all of the HIPAA guidelines and regulations in terms of data security and data. So that's something that they take very seriously and was important to us as we were kind of investigating them as a partner. But regardless of kind of your security perspective on that, you can access the information. You don't have to put any email address, your name. You can navigate to the website, search the zip code, search for the resource, copy down the information, email them directly from the ecosystem, and off you go.
And then once you're out of it, you're just out of
Yep,
it.
yep.
And so if you want to go back in, it's not like you're going back in and your name comes up.
Correct.
And you start over
Right.
again.
Exactly.
That's really great.
Exactly.
So is there any cost to the seeker or to the helper?
Nope, completely free. Completely free to both the helper and the seeker in the system. The Bloomington Health Foundation is really grateful to be partnering with the City of Bloomington and the local Council of Women as the funding partner. So our foundation was so excited about this innovative solution to this need that our board of directors, our local board of directors, said, "Hey, let's prioritize this as a funding priority for our foundation." And so we're very happy to be providing the funding in partnership with the local Council of Women to be able to bring this partnership to our community. So completely free, no ads, no, you don't have to accept cookies or do anything that might make you uncomfortable. It's a completely free resource for our community.
And I think it's really good. I mean, I think that a lot of times people think that resources like this are targeting or focusing on low-income individuals, but I mean, these are resources for everybody.
That's right.
Like you were talking about Meals on Wheels for seniors, or anybody could need childcare or anything. So
the directory has listings for free legal services. So if you're somebody that's looking for adoption services, there are actually listings in there for adoption services. Dr. McKinley again was giving the example of a patient who he's been their family practice doctor for many years, and he knows this patient so well. They were senior, they don't have any family that lives with them, so they live alone, and they just had a knee replacement surgery. So he knew that person, for example, was going to be homebound for a period of time while they were doing rehab and transitioning back into life. So his referral to them was, "Hey, Bloomington Meals on Wheels would be a great service for you for the next 4 to 6 weeks, because we know you're not going to be able to get out, maybe do your grocery shopping." Right. So again, regardless of that person's income, that was a service that they would be able to be eligible for, and he was able to connect them through the Helping Bloomington Monroe ecosystem. So,
and I think it really supplements things like 211, Look Up Indiana. There's somebody at the library that you can talk to personally if you don't want to do it. But I mean, it's not displacing any other resource.
Right. No, that's really important. HelpingBloomingtonMonroe.org is a complement to the other places that people can turn to for help. In our view, the barrier is access to care. And so how do we reduce that barrier? Having another place for people to easily, discreetly, quickly access services is a good thing. LookUpIndiana.org is a great resource that serves our community. Out of the Lutheran Foundation out of Fort Wayne are the sponsors of that. That really focuses on behavioral health and mental health services for the entire state. Indiana 211 is a good resource for folks. You can dial 211 from the Aunt Bertha Helping
Yeah.
Bloomington app if you're on your phone, and you can connect to 211. And also, if you want to, if you're somebody who need some help navigating the system, or you just feel more comfortable talking to someone, through the partnership with the Monroe County Public Library, their librarians and front desk staff have been trained on this service, and they're standing by. So
Yeah.
you can call someone locally here and say, hey, I'm trying to help a friend, or I'm trying to help myself navigate for food resources. I see here there's a community kitchen organization. I'm not really sure where they're located or how to get in touch with them. Can you help me understand this? And so there's a person there that's local, that knows this community, that can be that caring voice on the other end of the line to help connect them to the resource.
Yeah, I think that's really good. I think the other thing that's good are training sessions. So I sat in on the training session with the library staff earlier. Are there going to be any more training sessions in the community?
Yeah, so the training sessions, we had our, so representatives from Texas came up and did a training, I guess that was 2 days ago, or just yesterday. When was that?
Yeah, I'm not sure.
Was that yesterday?
Maybe it was yesterday.
Time's going fast. So we had our first training, and we had social service agencies there, and we do plan to roll out additional training opportunities for seekers, or excuse me, for helpers who want to learn about how to claim their listing, about how to really activate some of the robust features that the system can provide in terms of facilitating closed loop referrals. So that's a really positive development. So the ongoing trainings will stay tuned for more of those opportunities, and we probably see us doing those, quite a few of them right here at the launch, but then ongoing, maybe 1 or 2 a year ongoing, so that new directors or new staff and people, as they're kind of coming and going into these agencies, have an opportunity to come and get connected to the resource.
Yeah. So the site is live now, so people can get on
That's
it
right.
now. They can look at it. They can try to work through it, see if you can find your agency, see how easy it is to use it as a seeker. And then if you have questions, then who do they call?
The questions, if they have questions about how to get their listing in the system, again, they can access those opportunities directly through the Aunt Bertha ecosystem. If they have questions about the social services directory more writ large, they can certainly feel free to call me.
Or me.
They can call either one of us,
Yeah.
and we're happy to connect and answer questions. Again, we see this as not a solution that's going to fix this issue necessarily for everybody, but we see this as a big step forward in terms of helping to connect people to the resources that we have in the community.
I think it's really great. I mean, from the first time we talked about it, I was really excited about it. I was excited about how easy it was to navigate. Some of the people on our staff had already heard about it, and so just working with it to get it going and reducing paper, giving people a chance to access resources or information about resources either from the privacy of their home or the library. I mean, I think it's all great. I mean, this is really a benefit to our community, to the helpers, as well as the seekers. So I want to thank you for the partnership.
Thank you. Absolutely.
Yeah.
Absolutely. The Health Foundation, we're committed to improving the health of our community, and we stand with others who think that a way to a successful community is through a healthy community. And so we wouldn't be able to bring these innovative solutions without partners like the local Council of Women, without the City of Bloomington, without the United Way, without IU Health, without Centerstone. So it really does take a community to be able to move us forward.
And I'm glad you mentioned them, because I will say it wasn't just the two of us or the three
Sure.
of us
no
in the
question.
room cooking this up.
No question.
There have been a lot of people at the table
Absolutely.
helping to pull it together.
You know, Penny Caudill at the Monroe County Health Department, and Carol Weiss Kennedy at IU Health, and Mary Bally at IU Health, Greg May at Centerstone, Efrat Pfefferman with the United Way. So it's been a good collaboration.
Yeah, it has been. So thank you so much.
Thank
I don't know
you.
if there's anything else that you want to say. I want to make sure people know that it's helpingbloomingtonmonroe.org, O-R-G. And if you have questions, you can call John Barada at
812-558-2461.
or you can call Beverly Calender-Anderson, that's me, at 812-349-3560. So thank you so much,
Thanks,
John.
Beverly.
All right.
Appreciate
great
you.
job.
All right.